Good evening and welcome to Fraud Watch. Tonight, the federal government froze hospice enrollment across all 50 states. No new providers, not in California, not in Texas, not anywhere. CMS calls the fraud behind it pervasive and escalating. We've got a lot to get to tonight. Let's begin. To understand why CMS froze the entire hospice and home health system to new enrollment, you have to go back to Los Angeles. The administration suspended payments to 773 hospices and 23 home health agencies there, suspected of fraud, representing $70 million in suspended funds so far.
773 hospices, Marcus, in one city. That's not a few bad actors slipping through the cracks. That's a system that let the cracks become the entry point.
1 month later, CMS stopped trying to fix it case by case. On May 13th, the agency announced a 6-month moratorium on new Medicare enrollment for hospice and home health agencies. Nationwide,
We're today announcing a moratorium nationally. There will be no new hospices or home health care open in this country.
existing providers keep operating. But the door for new enrollments is closed in all 50 states, D.C., and every U.S. territory.
And CMS didn't soften the language. The agency said the risk of fraud, waste, and abuse in this sector is, quote, pervasive and escalating. Those aren't our words, Marcus. Those are CMS's words in their own announcement.
Industry groups are pushing back. The National Alliance for Care at Home says a blanket moratorium could hurt legitimate providers and limit patient access, especially in rural areas. That's a real concern, and it's on the record. But the crackdown didn't stop with the enrollment freeze. That same week, CMS made another move. The agency is deferring $1.3 billion in Medicaid payments to California. CMS Administrator Mehmet Oz called it the largest deferral the agency has ever made.
The President and Congress saved Medicaid with that bill. That became legislation. There's another $200 million at risk there. Added together, $1.34 billion. It's the largest deferral we've ever made.
Vice President Vance announced it directly, saying California has, quote, not taken fraud very seriously.
First, we're announcing that the federal government is deferring $1.3 billion in Medicaid reimbursements from the state of California. And the simple reason is because the state of California has not taken fraud very seriously.
This isn't 3 separate stories, Marcus. It was one escalation. Los Angeles was the warning shot. The nationwide freeze was the response. California was the consequence.
And by May 13th, the federal government wasn't just investigating fraud, it was pulling the emergency brake. Longtime viewers know we've been tracking Minnesota since our first episode. In February, the administration halted nearly $260 million in Medicaid payments to Minnesota over fraud allegations. In April, it deferred an additional $91 million. Combined, that's more than $350 million in Minnesota funding affected, going back to February.
Minnesota was the test case, Marcus. California is the escalation. Same playbook, different scale.
A nationwide freeze, a $1 billion deferral, a pattern that started in one place and is now playing out in the largest state in the country. CMS says this moratorium runs 6 months, but the agency has already said it can extend it in 6-month increments for as long as it decides the risk remains.
So the real question isn't whether this freeze ends in November. It's whether what comes next is bigger than what we just covered tonight.
We'll be watching. Stay sharp.